Hello, my name is Dr. Dawn. I am a pelvic floor physical therapist and postpartum specialist, and I'm going to tell you today a little bit more about diastasis recti and how you can actually screen yourself for it. So, diastasis recti happens in the third trimester of pregnancy on almost 100% of women. That separation at the abdominals, you have connective tissue that runs down the middle of your rectus abdominis muscles, your kind of six-pack superficial abs. Well, the connective tissue, it stretches, and as that growing baby is in there in the third trimester, you may see a doming, tenting, almost like a bubbling up of the midline area when you go from lying down to sitting up. So what happens after pregnancy is some women don't actually have that tissue come back together and it doesn't actually heal itself. And in that percentage of women, if it's still present at like 5-6 weeks postpartum, is where intervention of seeing a pelvic floor specialist, someone that knows postpartum recovery and postpartum rehab, we can help you be able to heal it properly and also prevent problems like back pain, prolapse, just feeling like your core is not able to activate as much. So I'm going to talk you through how you can actually screen yourself for it, because not all doctors will do this at the 6-week postpartum checkup. You usually have to ask. Many times they don't even know how to solve it except surgery, which is not true. So what you need to do is take 2 fingers, and what we do is check right at the navel, and then we go about 1 inch above and 1 inch below. You can lie down on your back and you'll place those 2 fingers right in that space. And I'm going to curl my chin up toward my chest, and I'm going to feel the edges of the abdominal muscles. Can my fingers go into that space? And how many fingers wide is that space? You may feel a little bit wider at the navel if you have one. And if you can fit 2 fingers or more in that space, it means that you do have a separation there, diastasis. Now, I am going to go right below the belly button, like 1 inch below. Do the same thing and curl up. Can I fit any fingers there? And then I'm going to go right above the navel, about 1 inch above, and do the same thing. So we're looking for how many fingers wide, but more importantly, how deep can your fingers go? Do you feel any tension in that tissue? Can you activate by pulling your belly button in toward your spine and curl up there and feel like a hard stop? Is that muscle able to actually contract deep in there? What we're checking for is the integrity of the tissue there. So if your fingers can go deeper than your first knuckle, then we want to be able to teach you how to properly activate those deeper core muscles, because it's not only the width, but also the depth. Those are 2 things that we look at. So if you're concerned about that and think you might have a separation there, diastasis recti, it's important not just to go on YouTube and research exercises, but actually going to a specialist. It's going to be more effective, and I promise women don't need surgery for this. If you are taught the proper way how to heal your core, you don't have to take drastic measures toward an invasive procedure. So if you have questions, feel free to reach out and we can help guide you through that.